breast cancer. Mike's going to talk about that, which mammography.
Yeah, of course. So everyone, knows about this, right? Most common cancer in women. So two subsets, family history, no family history. So with no family history, there's some mixed guidelines. We always used to say 40, and there's also 45, and now some are 50. And that's really much of because of insurance, right? So it depends on what your insurance will cover. But I like to go at 40. I like to stay at 40. I don't know if it's always going to be covered. It depends on your and also your insurance, I believe. But
No, they'll cover 40, and the argument that they get
they're stopping doing that though. I've had some people not being covered until they're 50.
Yeah, I mean, I haven't had that experience, but what you need to do is there's several guidelines there. The American College of Radiology, the mammography, who are board certified mammographers. I would look to them because a lot of these guidelines are made by what's called the U.S. Preventative Task Force. Not a fan, wish they would be disbanded because, for example, the breast cancer guidelines made by them. So they're a volunteer group, essentially the government, but they're family practice, internists, OBGYN, epidemiologists, and nurse practitioners. There's not one breast surgeon on it or breast oncologist who looks at the evidence and makes recommendations for the masses. Okay. And to me, it's unacceptable.
Well, the common guidelines are basically 45 without family history, 40 with a family history. So that's kind of what we go by. I mean, I order, probably 50 mammograms a month, right? So I know. But I will say, it's interesting, right? So when I started, I used to get a mammogram on everybody. And the reason I did that, and I'm talking about even like young girls, and the reason I did that was because I wanted you to have a roadmap of the breast before I either put an implant in, or I did a lift, or I did a reduction, or whatever I was doing, because it'll change things around. And then if you have a mammogram later on, just say you're like 35 and I get a mammo, and then you get one at 40, you could at least compare and have something to compare. I stopped doing that since, but I picked up a fair amount of breast cancer, believe it or not, in women under 40. And one case I had, which I always remember till this day, was I had a girl probably in her late 30s, and she refused. She did not want it. And I said, well, I'm not going to do the surgery then. I was pretty stuck to that at that time. I since changed. So she begrudgingly went and had a mammogram, and she had breast cancer, and was cured from it. So
and she had no family history.
No family history. Right. So it's definitely, and me and Mike go back and forth all the time, right? So about these unnecessary.
But let's remind everybody, we're talking about average risk.
I'm talking about average risk, but I'm also talking about someone that I was operating on. So it's not just a random person. I said, go get a mammo. Right. This is someone that I was going to change around their architecture of their breast. So I felt, and a lot of people did, it wasn't just me, that it was good to have a baseline mammo before any surgery. Since then, no one really does it that I know of. So I stick to the guidelines now, but it's just anecdotal that I like to throw in there. But basically, family history 40, no family history 45. That's what I'm going by right now.
Well, I'm gonna. Then there's one other group of people. So the National Cancer Institute says that you can do 30 years of age or before if you have a family history of somebody with breast cancer who was diagnosed before they were 30. Okay, so really young. Or somebody who is a first degree relative with BRCA1 or BRCA2, or you have BRCA, okay, it is acceptable in that case to start before you're 30. Or if there are kids who've had radiation for various reasons, like childhood cancers. So if you've had radiation between the ages of 10 to 30 years of age, there definitely is a subgroup of population who should probably get a mammography at 30 years of age. But these are a separate case. This is a separate group of people. who are high risk, but your average risk is exactly right. 45
And
or 40,
and if
depending.
you have a relative, first degree relative, has a history of it, you need to talk to your doctor about when to get these tests, but also about genetic counseling.
Yes.
You want to go for genetic counseling, and you want to get, BRCA1, BRCA2, which is a simple blood test, gene test. So, and then you can, discuss prophylactic, mastectomies and stuff like that. But what I would say is family history does change the dynamic. So with a family history, you want to go for counseling. Either way,